Hi, I'm S.G. Brownlow. When you think about brains, when people are born, the only thing that really works in their brain is their brainstem, this part right here at the top of their neck, which is responsible for things like breathing, heartbeat, digestion, sleeping, just really basic kinds of functions. And that's pretty much all a newborn can do for the first little while, because that's all their brains are really set up to do at first. But over time, brains have a specific pattern of growth. Brains always, unless there's something really wrong, they grow from bottom to top, from inside to out, from back to front. And girls' brains grow from left to right, and boys' brains grow from right to left. Now, I can probably spend hours unpacking that description of how brains grow and talk about all the implications that have in psychology and in practice. But in this video, I want to focus on one of them, what I call a critical period for emotional growth. And that critical period it differs a little bit between children, but it's sometime between 3.5 and 4 years old. And what happens at that time, there's two developmental things that happen at that time within the brain. The first is that the prefrontal cortex first comes online, which is, in adults, we consider it executive functioning. It doesn't work that way really in kids yet, but it's the first rudimentary ability to plan, to think about what they want, to weigh past experience, to understand a little bit more about how they're feeling instead of just reacting to it. And the other thing that happens about that same time is that the right temporoparietal juncture comes online, which is where we isolate in our brain our sense of ourselves as distinct people with distinct needs and distinct wants. So as our sense of self is really contained in that area. Now, before that age, before this critical period, our sense of self is very implicit. We don't really think about ourselves explicitly, but once that develops, then we have a very explicit sense of ourselves and of our own volition. And so when you think about young children, you hear about terrible twos, but a terrible 2-year-old is really oppositional, is really what they are. They don't know what they want. They just know that they don't want to do whatever you tell them to do. They're setting themselves apart somehow from you, but they don't have any really independent desire on their own except to show that they don't have to do what anybody tells them to. A 4-year-old is very different than that. 4-year-olds are very willful. They know what they want. They know exactly what's going to make them feel better, and by God, they're going to go get it. And so they're in many ways much more of a handful than a 2-year-old is. Now, why all of this is important is that in that range, we not only understand who we are, but we're also able to now plan and create, and we start telling ourselves stories about who we are and how we feel that then become incorporated into our sense of identity. And as we do that, the things that we notice are the things that are the most painful, because those are the things that we want to avoid. And so with most people, typically, I'd say especially men, but it's very common in women too, usually what's most painful when you're 3.5 to 4 years old are the feelings that as adults we call shame. It's feelings of inadequacy. And so we somehow don't feel like we measure up, and so we don't want to talk about that. We don't want other people to find out that we're not good enough, or we don't think we're good enough, or we're pretty sure we're not good enough, or depending on the levels of shame that we're talking about and how deep you want to get with people. And so a good shorthand with most people, if you don't know them very well, if you just kind of bet, okay, inadequacy is probably sort of the bottom issue here that we're going to have to deal with, you'd be right. And that becomes important because I think most therapists know that the presenting problem that people bring to therapy is usually not the problem that's driving most of their more serious symptomatic behavior. And so if you kind of know what the deepest level is that you're going to have to help them clean out, that's helpful. But what I want to point out is that that's not always the most painful emotion when you're 3.5, 4 years old. The other day, I was contacted by someone who was asking me for some case consultation. And this is a therapist that I know really well. I've worked with for several years. And she was telling me about this guy, and she was concerned about how his treatment was progressing because it seemed kind of off to her. He came in complaining of anxiety, but pretty quickly he was talking about inadequacy, and so by the second session he was talking about all these things that were going on with him that he felt really inadequate about, and he was stumbling and fumbling about it and having a hard time putting it into words. And she was understandably, I'd say, concerned about pushing him because she was afraid that she was going to push him too far and he was going to get to some really painful stuff really quickly and she was going to lose him and he wasn't going to come back. That's a pretty reasonable expectation. But as we got into talking about the guy's history, what actually stood out with this particular guy is that he had spent 15 years in foster care. And so he would have had to go into foster care when he was probably 3 years old. And before that, like most kids, I'm sure he knew that there were problems and he was trying to be a good kid and he was doing all that, and somehow his parents went away. And so there were reasons for him to feel inadequate, to feel like he didn't measure up, to feel like he wasn't a good kid. But what actually had happened is that once he got to foster care, he had really attached to this foster family, had really settled in, had really loved his foster family. But now as an adult, some other stuff had come up and he was being forced to make some decisions. And it really had to do with loyalty. And depending on what he decided, there was a good chance he was going to lose these relationships with his foster family that he had lived with for so long. And so when you look at his history and what was really going on when he was 3.5, 4 years old, what the most painful emotion was for him, it wasn't inadequacy. It was a deep sense of loss that felt probably close to death. And he'd experienced that with his birth family, and now he was anticipating having to experience that again with his foster family. So it's not always about inadequacy. It's about whatever the strongest, deepest, most painful thing is that was going on with you and was active with you when all of that stuff clicked on. If you realize that you've got some of these same kinds of processes going on with you, and you're ready to work through them and get on with your life, contact me. Let's see how we can help.